Centers for Disease Control estimates that 2,000 young people will die each year of sudden cardiac arrest.
February is American Heart Month, and we hear, well, frankly, anytime we hear about it, it's too often. Seemingly healthy young athletes collapsing during a game. Dr. Gigi Chawla, the chief of pediatrics at Children's Minnesota, is here now. There we go. That's right.
Camera.
It's all good. It's great to have you with us today.
Yeah. Thank
you.
This is something in the news that we hear about, but I've talked to my kids about this as well, as far as how they're ready at their school.
Right.
Because you do worry about kids who look healthy and then something goes wrong.
Right.
Well, fortunately, this is such a rare event, but it really is such an important event. And I think, families really need to be aware of what they can do to get their child and their athlete ready, which is the first step is honestly, have your annual physical exam by a pediatrician or a family practice doc to really do a head-to-toe evaluation.
And a lot of times the high school sports league, or all the times the schools in high school sports league require that before these kids get into actual organized sports.
Yeah, they actually require an exam every 3 years. But children's
Do you say more
health,
than that?
Yeah, so we really want to make sure that kids get in every year because things change and their bodies change, and we really want to make sure that we're paying attention to some of these critical issues.
Are you really catching stuff in those? Sometimes I worry that it's just like, here are your shots, like here's your blood pressure and you're fine.
Yeah, I mean, it's the only opportunity that we get to really find a time to catch things. So yes, I think the other really important thing, especially when we're talking about sudden cardiac death, the most common reason is hypertrophic cardiomyopathy, which is a real thickening of the muscle of the heart. And sometimes you can get some clues about it. You can hear a murmur, you can hear a different sound that your heart makes, or you can get some of the family history around a sudden death in a family member, since it is genetic, or you can get some of the symptoms that kids may describe, that they passed out once, or they got dizzy with exercise, or they have chest pain, or some of those subtle things. So it is really important to get in for your physical exam so we can start to talk about some of those issues.
So then what do you do if you hear something like that, a murmur? Then can you do further testing to actually see, do they have that?
Absolutely. So it is, once you're on a path towards, you've got symptoms or you've got, some kind of story or family history, then the next part of the workup really is, an EKG, which is the, an evaluation of the electricity of the heart, or an echocardiogram. So the diagnostic part is pretty straightforward. It's really getting kids in, getting the history, understanding the family history. That's really important.
Do enough schools have those kind of devices where you can bring a kid back after a cardiac arrest?
Absolutely. All schools should have that in place, and it is the most important point about this story is to make sure that all athletes, all family members, coaches, etc., know where their device is, know how to use it, because it's life-saving.
All right. Dr. Gigi, thank you.